Hello. I'm pleased to present today Andy Meyer, who's our nurse navigator for our University of Cincinnati Cancer Center Comprehensive Breast Program. Andy has been part of our team for many years now, and she's really the glue behind how we make everything happen. I think during the pandemic it is particularly fitting that we hear how Andy and her associates are able to help patients navigate through this storm. And in fact, we've entitled Andy's talk today, Navigating the 2020 Breast Cancer Storm. Andy, please talk away.
My role as navigator for the breast team is to help patients navigate through the system efficiently, timely, and as seamless as possible. We strive to deliver the highest quality of care at all times. Breast cancer treatment is multidisciplinary and usually includes a combination of several teams, including radiology, pathology, surgical oncology, possibly plastics and reconstructive surgery, medical oncology, radiation oncology, and several other ancillary services. As a navigator, my role helps patients transition between each of these services in the appropriate order, providing education and information for understanding of the treatment team plan. UC Health's breast program holds triple accreditation from the NAPBC, NQMBC, and ACR, which all speak to quality of care and timeliness of care measures. We're held to a very high standard for our program to meet for our patients in order to maintain and remain in compliance. The COVID-19 pandemic has affected just about every aspect of life, including screening, diagnosis, treatment, and follow-up care for breast cancer. It has created so much more anxiety for patients, putting them in a difficult and frightening positions. Some delayed seeking workup initially out of fear of leaving their home to come for an office visit. Aside from the usual questions of, will I lose my hair? Can I work through treatment? What does HER2 mean? What will chemo be like? What do I need to do to get through treatments? Patients just wanted to know if they could get treatment. Is it safe to come to the office for visits and treatment? We shifted education to letting patients know the precautions we as a team were taking within the Barrett Center, the hospital, and for patients at each step along the way in their treatment. As the COVID-19 developments came about by the CDC, UC Health continued to revise and change the plans for treatment, again to maintain safety and not affect prognosis of patients. As we have all heard from all the previous week's speakers, the COVID pandemic has created many disruptions in service. We have very specific guidelines that we as a breast team are used to following to help us meet our goals and deliver the best care. Beginning with radiology and the closure of screening mammograms, the imaging center was closed for several weeks to screening, which is where radiologists find so many early breast cancers. Surgery was affected by being unable to offer reconstructive surgeries. Only definitive breast cancer surgeries were scheduled. Surgeries were delayed as patients were afraid to be in the hospital. We found ourselves reversing the usual order of treatment by giving oral hormone therapy, manipulating therapies, while patients waited for surgery to keep the cancer from growing. Radiation pursued new treatment programs to decrease the number of radiation treatments without sacrificing quality or efficiency or efficacy of the treatment. Medical oncology was able to continue with necessary chemotherapy infusions, but patients were unable to have anyone accompany them to appointments or infusions. Patients had additional concerns about their increased risk of contracting COVID-19 with their immunosuppression. The entire program shifted to televisits as appropriate. My role had to adjust to providing so much more education for patients to understand their treatment plan and the adjustments we needed to make with the ever-changing COVID updates without affecting prognosis, efficiency, or efficacy. COVID-19 complicated the path for patients during a time when they were already anxious enough about their new breast cancer diagnosis. Our team worked very hard to see that COVID-19 did not affect us meeting the needs of the patients, as we were able to make all the necessary adjustments. Slowly, we've been able to get back to a more normal course of treatment for our patients. We will continue to evolve as COVID-19 continues to change and look forward to 2021 improving. Thank you for choosing UC Health Breast Cancer Center. For a mammogram, you can call 513-584-PINK. And for an appointment with our treatment team, you can call 513-584-5023.
Thank you so much, Andy. As I mentioned, you are totally the glue for every part of our system. in trying to provide timely diagnosis and certainly appropriate treatment and follow-up. So thanks for everything you and your group do to help us get through this time period. You know, the pandemic has taught all of us so much about resilience. Every day was a little bit different. We had new challenges, but I think we're entering into kind of a new phase with the pandemic. You know, we now know how to get into the center safely. We know about the precautions about minimizing risk of infection, getting treatments done. Surgeries are pretty close to normal again, if not normal. But we're left with this nagging, I'm still not in a normal world. And I think many of our patients are very fearful about what the fall and winter might bring. Can you give any insight into services that can support them, especially some of our older patients or even our younger patients that live alone and may really feel that social isolation piece? What can they do to get through this tough time period?
So every time I meet a brand new breast cancer patient, and these services are not available just to new patients, but every time I do meet new breast cancer patients, I give them good contact information we have a dedicated social worker who works with our breast team. I give her their name every time I meet someone so that she's ahead of the game and has their information and she can reach out to them even if they don't want to contact her. We also have a number for the American Cancer Society that I also give to the patients initially and up front. But all those services are still available to all patients, no matter what stage or phase they're at with their breast cancer treatment. We make lots of referrals to outside services as far as Cancer Family Care, Cancer Support Community. There's the Pink Ribbon Girls for the breast specific, and a lot of other ancillary services. We have financial services within UC Health that is also able to support us. So all of those services are available. During the COVID period, initially a lot of things closed down, so we had to re-navigate that as well. But a lot of them are quickly getting up to speed with COVID, and we're doing a lot of things online, telephone calls, things like that. A lot of the group things closed down, but slowly they're starting to reopen and have those. But they've almost always been available, at least by website, by telephone, and phone contact information.
You know, I think the most important thing is that people realize that we want to be a lifeline for them. And as the days shorten and get dark, you know, there are resources out there. Spring is going to come, and we're going to get through this tough time period all together. You know, that being said, has the pandemic brought anything positive either into your professional world or perhaps personally? Can you tell us about any silver linings that you might have experienced?
So one kind of a fun thing is we actually had a patient who made us all for the breast team pink masks. So we all put them on kind of on the same day. We took a picture, you know, just some simple things like that to make it a little more exciting. We all kind of planned, you know, let's all wear them today. And the day the patient came, we made sure we had them on, got our picture taken, and it was sent to her. So just something simple like that, you know, and all the masks, even though none of us are crazy about wearing them, I find that the staff are all putting on some kind of fun different looks, you know, each day, coordinating with their, you know, their glasses or their hair or whatever they got going on. So that's been kind of, you know, rolling with it the best that we can. As far as personally, you know, I have two sons that are, you know, out of college. My youngest just graduated this spring, so they both are home, you know, as we're getting through this. So it's kind of nice because it's been a long time since all of us have been under the same roof. My husband's been working from home, so projects are getting done at home, which is very nice. But just being together, and it's been a long time since we've had a normal every evening family dinner together, and we've been doing a lot of that now. Maybe too much, and they're probably ready to be finished, but at least it's been, so having the family back together has been probably the blessing that I have found in all of this.
Yeah, I think that's clearly that pause button that we all had to hit gave us a chance to reflect and enjoy the good times with family and friends. I thank you so much. I have one final question. If you had that proverbial crystal ball, can you tell us how long you think the pandemic will last? That's a question our patients ask us almost every day, don't they? When can I stop wearing a mask? What do you think is your estimate?
I really think at least through 2021, there's not going to be. I know we're going to have to survive like this winter with, as we start getting seasonal allergies, that people are going to be confused with, oh my gosh, are these COVID symptoms and they're colds, the flu. I think we're going to at least have to get through the winter, and then that may roll right into the spring allergies. So I think at least through 2021 at a minimum, and I think if we survive winter and spring without too many hiccups, that maybe 2020, that 2022, the masks will start to come off or move forward a little more.
I think we should have had a lottery to see who's going to be closest. I didn't think about that early on in this process, so we'll stay tuned and see where we.
Somebody's
That's
pregnant
right.
baby or due date or whatever. Yeah.
Well, I thank you so much, Andy. Again, this has been Andy Meyer, who's the nurse navigator for the University of Cincinnati Cancer Center Comprehensive Breast Cancer Program team. We appreciate her insight and thoughts and everything she does to keep all of us rolling forward and providing the best care that we can. If you enjoyed today's video, please remember to use your social media to pass this on to family and other friends. Next week is our final video, and we have a very special treat. This will be an interview specifically from a patient perspective. And the patient that's going to give you all of her insight is Sherry Hughes, WCPO meteorologist. And so with that, I thank you, and we look forward to next week.